It's my pleasure today to welcome on Physio+10, Pat Trott. Pat, I really like to start these podcasts for our listeners to find out what it is that provoked you or motivated you to embark upon your journey towards the profession of physiotherapy.
Well, Doug, I'm actually a country girl, country South Australian girl, and went to boarding school in Adelaide for 8 years. And I suppose in the last couple of years, I was wondering what I might do. My grandfather, who actually lived with us at home, he was a dentist. And so I told him I thought I'd do dentistry. And he said, "Oh, no, that's not suitable for girls." And I said, "Oh, well, I'll do nursing." And then he said, "That's just the seamy side of life. No, you're definitely not going to do that, my girl." So the other thing I'd always wanted to do was be a pig farmer. And our property was, vines and orchard. And Dad said, "Well, you're certainly not going to have pigs." So, I really didn't know what I was going to do. And then a family friend who was a physio, I saw her one day and I really liked her, and she was working at the Children's Hospital and I like kids. So I thought, all right, I'll be a physio. And so I applied to the University of Adelaide, and well, then I did physio.
Okay. Now, just backing that up, having 3 generations of family living at the same time in the same house, how was that? Because that's not probably that common.
Well, of course, being at boarding school, I wasn't at home for 8 years,
Yeah,
so
sure.
it didn't really impact on me. But I'm sure it was difficult having Grandpa there at times, and he was certainly the head of the house. He liked to sit at the top of the table and carve the meat, and Dad sat alongside. So,
Wow.
good old Grandpa.
And living on a farm, like as you said, you went to boarding school, so you're back for school holidays and times like that. But did that farming, that rural lifestyle, do you think, looking back, have an effect on you in the types of things that you're interested in?
Yes, definitely. Well, I said I wanted to be a pig farmer, and that was squashed. But more importantly, and recently, I've got one brother, or at least I had one brother. He's died, and he did accountancy, but he took on the property because everything in our family went from father to son.
Yes.
And so that was a vineyard. And he and a cousin of ours, Geoff Trott, they started the winery Wirra Wirra. Wow. And I was really interested in winemaking and learning about things from that aspect too. So yes, it did make a difference to me. And when I first graduated, I thought perhaps I'd have a practice down there at McLaren Vale, but I didn't. I went on and worked at the Queen Elizabeth Hospital. I really stayed in hospital practice for some years. So that's probably as much as, I guess, the country influenced what I have become.
Yeah. Were you were younger than your brother? There were just the 2 of you?
No, I was older.
You're the eldest.
4 years older. So we were almost like single children, because I was at boarding school. Then he went to boarding school. And I went to university. So our paths just crossed in holidays, really.
Yes. Okay. And like, obviously your grandfather, it's interesting you said not do dentistry, but would you say that that personal experience with the lady that interested you in physiotherapy was enough? Because nursing was kind of the thing, wasn't it, for women at that stage, nursing or teaching?
Yes, it was.
Yeah.
No, I really liked this Wendy. She was particularly nice. And I sort of talked to her about what I might do, and she talked a lot about physiotherapy and doing it. And that really did influence me, and for the best, I think, because it's been a great career for me.
Yeah, and I think that's the thing I've always enjoyed about these conversations is, sure, you're a physio, but the diversity of things that people have taken on in that profession is just, it's outstanding how many things people can do. So you wandered on to Adelaide. It wasn't a university at that stage, would it? So was it
Yes, it
a
was.
TAFE?
It was University of Adelaide.
Oh, okay.
I think it started there back in the in the 1940s, and I was 1959, so it had been at the University of Adelaide for some years.
Right. And the
And
course, sorry, was it a diploma or a degree?
no, diploma, 3 years. And that was the same everywhere in Australia at that stage.
Yes.
Then the course moved from there to the Institute of Technology,
Ah, right.
and that later became the University of South Australia. So um, that's how, the program's gone over here in South Australia.
And do you understand the reason why it did move from the University of Adelaide to, I guess, eventually the University of South Australia?
Yes. Do you remember a chap called Dawkins? There was a Dawkins report that he put out federally, and that proposed that all diploma courses be moved out of universities.
Right.
So that meant that physiotherapy and pharmacy were two such programs that moved then to the Institute of Technology, which had a long history itself. It's been what would it be, probably about 140 years old now. But
Right.
of course, it then amalgamated with colleges of advanced education and became the University of South Australia in 1990. So we essentially had 20 years as an institute.
Yes. And when the course eventually became a degree course, was there a move to take it back to the University of Adelaide?
No, because we actually got a better deal by being at the institute. We were given better accommodation. We had more staff. So all round, it was a positive thing for the school.
Right.
So we didn't go back. And I don't think universities were taking any programs back anyway, because pharmacy has always remained within the institute and thence University of South Australia.
I asked the question in part because I remember when speaking with Lance Toomey that the School of Physiotherapy here came up through the West Australian Institute that then became Curtin University, and
That's right. Very
there were
similar.
encouragements to take it in under the UWA banner at some stage when Lance was there. And I'd wondered if maybe something similar happened in Adelaide for you guys as well.
No, I don't think that was ever proposed or thought about.
Yeah.
And that's all. Actually, I was going to say and, but I can't think what the and was going to be.
That's fine. Now, when you first graduated as a physiotherapist, I'm always intrigued to find out what it is that people really remember about that sort of first 6 months or a year. Was it the paycheck? Was it the autonomy? Was it the freedom? What was it for you that you most remember about becoming a physiotherapist?
Well, I worked at the Queen Elizabeth Hospital here in Adelaide, which was considered probably the best for new graduates. And I really loved my time there. I immediately went into outpatient orthopedics, then inpatient orthopedics. And I really enjoyed working with the orthopedic surgeons and just loved that work. And then Dr. Bunt Burnell, was in charge of the department down there, and he was a doctor of physical medicine. And my next roster was with him.
Ah,
And his background was fairly strong in manipulative therapy. And he had actually done his med training in London and studied under James Cyriax.
yes, the legend.
So, yeah, so that really interested me. And he was such a good diagnostician and clinician. And the next year, he invited me to work in his private practice. And that was a terrific experience for me. And during that time, his later wife was a physio from London and also came from St Thomas's Hospital. So it wasn't surprising that they encouraged me to go overseas and gave me references to help me get a job over there at the Royal National Orthopaedic Hospital. And really, I had only just arrived there 2 or 3 days, and I got a phone call from G.Grieve
Ah,
inviting me to come and teach on their first 3-month MNIPS course. Oh, and this was just amazing. There was I, a 23-year-old with absolutely no experience, and certainly no experience of teaching, to be invited to join Greg and Jenny Hickling. The hospital were positive. They gave me time off, in fact, gave me full time off so that I could actually attend every lecture and clinical setting that the students on that course attended. So I learned terrifically from James Cyriax and Alan Stoddard. Remember, he was
Yes, yes.
an osteopath, and several other well-known doctors in rheumatology and so on. So I was so lucky to have had that experience. And I helped with the teaching of techniques, and I supervised the students clinically in hospitals. And one of the hospitals doing it was the one that I was working at, the Royal National Orthopaedic Hospital, and the head of the department was actually my student. So that was a bit, well, could have been tricky, except that Jane Odgers was a delightful person.
Wow.
And so, because over there was a lot of resistance to manipulative therapy from hospitals and teaching staff. So they decided to run this program such that the first intake of students were all superintendents of hospitals. So they're rather formidable people, you know, they're used to running the show. Actually, though Jane was really very nice, but that really so interesting, because many of these heads of department really hadn't done much clinical work. They'd been more administering the department. And, you know, I can still remember them. They would get a patient and they'd say, "Oh, and what is wrong with you?" And the patient would say, "Well, I don't know." I mean, what a way to start one's patient encounter. But anyway.
So this is more of a strategic thing to bring in these heads of physio departments to take them through the MANIPS course, so then they could be au fait with what the whole program was about.
Yes, and that it wasn't just forceful manipulation a la Cyriax.
Yes.
That was the thing that we were very nervous of.
Now, I remember a story when I went to Canada for a couple of years, and they were quite influenced by Maitland in regards to their assessment, and Cyriax and Stoddard and a few other practitioners on the treatment side of it. And one of the practitioners there related the story of James Cyriax coming across from London and giving a lecture in a large auditorium, about 600 physio participants. It was a massive demonstration of manipulative techniques on a stage. And he had this girl lying down. He was demonstrating cervical rotation manipulation. And as he wound her up and then gave her the big thrust, his microphone, which was hanging on his neck, scrubbed across her hair. And of course, there was this almighty scratching noise go right across the whole auditorium. And everyone held their breath for about 3 seconds just to see if this poor girl was going to live after that massive manipulation.
Yes. Oh, it reminds me of when he came to Adelaide. A similar thing happened. And he said, "Oh, hello, Pat." You know, he remembered me, which was good, I suppose. And then he asked if I would be his subject, you know, while he demonstrated. And he did the same thing, that rotation. And not only was it forceful rotation, but it was done under traction as well.
Yes, yes.
And he also used to do another one where he would traction the head and neck and then go into full extension. Must have been very good for the vertebral arteries, I think. But,
very testing.
Oh dear. Yes.
So you survived that demonstration as a specific as well, did you?
Yes, I did. Thank goodness.
Now this is all. Yeah, this is all happening in the first 5 years, isn't it, of your career, really?
Yes, it is.
That's an amazing start, like coming under the influence of such key people in the manipulative world of physiotherapy. It's no wonder you did end up traveling down the pathway that we are about to explore. So how long were you in London, and then I guess you came back to Adelaide?
Well, I did. I intended really to stay overseas for a number of years and to travel through the Middle East, but my father died. So I came back really within about 14 months, I think. And when I came back, I was invited by Mari Hammond, head of the school, to come and teach. So I fell back into a job, albeit part-time. And the other half-time, I set up my own private practice and practiced for, about 25 years part-time.
Now, is it around about this time that you were involved in the development of that 3-month certificate in manipulation of the spine course?
Yes, it was.
Yeah.
Geoff was obviously the main teacher, but he left a lot of the theory side to me and hoped that I would prepare the lectures on that side of it. And Mary Hammond, the head of school, was very positive about us running the course. Mind you, in the first instance, it wasn't run within the school, it was run within the South Australian branch of the APA.
Yes.
I don't know why. I suppose that you couldn't have just suddenly set one up in a school. So it wasn't until we moved to the 12-month program, the graduate diploma, that it then became a university program.
So your role was largely preparation, admin, teaching theory. When was the first course actually conducted, Pat?
Um, well, the first course I think was 1964 when I was in England. The next year we didn't run one, don't know why. And then the following year we ran the second course. The first course with just Geoff, there were only 3 students, and Brian Edwards was one of those. And then when we had our second program, because there was both Geoff and me there, we increased it from 3 to 6 students.
Right. Can you recall who else went through with Brian in that first course?
It was somebody Wilson from Melbourne. And in thinking about this and thinking about chatting with you, I can't for the life of me remember. It was another fellow from Sydney.
Okay.
And he really didn't go on to do anything that led the teaching of manipulative therapy, as far as I can remember.
Right.
And perhaps that's why I can't actually remember his name.
Yeah. Okay. So then there's a
He
gap
must be
year.
my age and probably not around now, as I'm in my 80s. He would be too.
Yeah. And so you had a gap year in 65 and 66. So 66 was the first big course with 12 people, you said?
No, 6.
Oh,
There were
6.
two and 6 of us. And we didn't increase in size until we offered the graduate diploma.
And this is when we moved from a 3-month course under the auspices of the South Australian branch of the APA to when it's actually moving in towards a graduate diploma in advanced manip therapy. And that was at South Australian Institute?
That's right, yes.
Right.
And when we first started that, we were running both the 3-month and the 12-month concurrently, the very first course. And we started the program with peripheral work, and there were 3 of us, 3 students, and I was one of those students. So we did our peripheral section, and then we were joined probably by another dozen physios for the vertebral part. And for that, I switched half. Mostly I was teaching, but I did some of it as a student as well, which was a bit amusing for some of the other students.
That's confusing. So the peripheral bit was done by Geoff directly himself?
Geoff doing all of that, and for 3 of us, and we were 3 Adelaide physios.
People. And was that, why didn't the ones that were doing the vertebral component, why weren't they doing the peripheral component?
Because they were had only come over for the vertebral. That was what we were teaching.
Right.
It wasn't really part of the graduate diploma.
Okay.
Well, it was really, it was part for us, but they came and only did the vertebral section, and then that was phased out.
So then it moved into just being a 12-month program and you did the whole lot.
12-month. That's right.
Right.
Yeah.
And is that when you sort of also moved into full-time teaching of it?
Well, I was never full-time. I was always half-time in my own practice, and we would run the course in the afternoons. Well, the students might do some theory components like anatomy and pathology and those sections, but for the actual physiotherapy part, it was half-day commitment, and Geoff was in his practice the other half of the day and I was in mine.
Right. And do you know why it moved then, I guess, from the South Australian APA across to the university or the South Australian Institute at that time?
Well, it moved because we wanted it to encompass not just vertebral, but peripheral as well. And we wanted it to be a graduate diploma and within a university and have university status.
Right.
So we had to obviously rewrite a lot of the theory that we had been doing and expand things. And the students had to do a research project of some size, really, as part of their graduate diploma.
And to put this into context, in the 60s, I was reading that G.Grieve was sort of simultaneously developing a manipulative therapy course or program in the UK. Was there much communication between the two groups as to content and curriculum?
Not a lot. Well, he and Geoff communicated a lot. They were good friends. I didn't really speak with him very often. It was really Geoff. And a couple of times Geoff went over there and did a bit of short-term teaching as well. But otherwise, we ran our programs. I'm sure Geoff and he discussed what being taught, but no formal connection between us that I know of.
Okay. And did Greg, I know Greg, when I was doing Minips in 92, Greg came out and actually, I'm not sure if he did an Australian tour, but he certainly came to Perth when Bob Elvey was running the Minips program, and he gave a presentation titled Masqueraders, which was looking at tumours and things like red flag stuff. Did he also come out to South Australia? And
no, he didn't teach in Adelaide at that time, but interestingly enough, when he was going back to England, he was on the same plane as Ruth and I, and we were on our way to England to teach. But we didn't know any of that. And I heard Greg talking to somebody in the Qantas club in the lounge. And I thought, gosh, I know that voice. And sure enough, it was Greg. And he said he was fascinated because I was actually going, that's right, there was a wind, hurricane warning, and we couldn't fly. And that's why we were in this lounge for hours. And I was going through my notes, and Ruth was going to be doing some teaching as well. And every now and again, I would get up and do a few, movements of some sort. And he thought, gosh, that must be a physio. And then he realised who we all were. And so we did catch up with him, but not as him coming out to teach.
Right. Now, while we're talking about... Sorry, go on.
Was that towards the end of his teaching career when he came, do you think? I'm just trying to...
Well, 1992, he was developing the Manip courses 92. In the 60s.
Okay.
So, yeah, I'm guessing it is. It's 30 years later.
Yeah.
I actually I had one of those little tape recorders that I put up at the front of, it was quite a large, we had people from America there for some reason too, and it might have been part of a Minips conference. So there's quite a large area of people listening, and I sort of slipped up the front with a little recorder and just stuck it right in front of him, thinking I'd be a real bright spark and get a recording of this, because no one else was recording anything. And when I found it, 15 years later, I found this little digi-cassette and I started playing it, and it's got this noise, and I stuck it right under the whirly fan right in front of me. So all I can hear is this fan going around and around, and every now and then I'll hear some pearl of wisdom from Greg come through, but I try to get it, analysed, and guys said there's no hope we can take that noise out. It's throughout the whole tape. So unfortunately, my idea was good, but the outcome was pretty poor.
But it didn't actually work. That's disappointing.
So whilst we're sort of talking about this sort of Minips development, it's probably a good chance to talk a bit about Geoff and his role in the development of musculoskeletal physiotherapy. When did you first meet Geoff, and what do you recall of that meeting?
Well, I met him as a second-year undergraduate student. He took us for outpatients, and I don't really remember anything very much about him, and had no idea that he was going to go on and become famous, and that I would ever work with him. And he very much was planning his overseas trip, because the next year he went over to England and to America and spent time with obviously G.Grieve and Jenny Hickling, the physios, and with the doctors that I mentioned before,
Yes.
Cyriax and Stoddard. And while he was in London, he really, it confirmed to him passive mobilisationist techniques were really very important and should form part of our armamentarium with the more forceful thrust techniques that they were doing at St Thomas's Hospital,
Under
which
Jerome
were
Cyriax.
really very scary. So that was sort of my early time with Geoff, and then I didn't have any further time until I came back to the 3-month program.
Okay.
But
That I can understand the links, and we've talked about them with the UK, but I'm surprised. What was he doing in the US? Like, who was he meeting there? Do you know in regards to sort of the manual therapy world?
well, particularly the two Mennells, James Mennell and what was the other Mennell? Can't remember. There was the father and son Mennells that
Okay, in the
have
osteopathic
written
world.
textbooks. Yes, and he spent time with them. I don't remember at that time that he spent time with the other physiotherapists who came up later in both the US and Canada. I don't know that he spent time with them,
Yeah.
but he may have.
Okay. In regards to physiotherapy, then, how would you describe the contribution that Geoff has provided from your perspective?
Well, I would say he's probably contributed more to physiotherapy in Australia and overseas than anyone else that I can think of. I mean, we think of Geoff and his contribution to musculoskeletal physiotherapy. That's probably what he's known best for. When you think about the use of passive mobilisation, he was the one that developed the grades of movement. He and Jenny Hickling spent a lot of time together on the aspect of teaching passive movement. And they came up with movement diagrams where you could actually draw on paper what you were feeling, recording the patient's symptoms and the resistance or stiffness that you came across. So he was important for that. And obviously he wrote his two textbooks, vertebral manipulation in 1964, I think it was, and then peripheral manipulation in 1970. And of course he published several books after that. But he was an exceptional clinician. I was so lucky to spend so many years with him and be able to learn from him as he was teaching the students. So I repeated again and again. He was very, felt that subjective examination was very important. And it was always interesting to watch he himself taking a subject of in the history from the patient. He always sat just below the patient. He often sat them up on the treatment table and he would sit on a stool beside them. He felt that being slightly below them was important, that they were less scared of him as a physio. And as he listened very carefully, if he asked a question, he always used the wording that the patient had used. So it was really reinforced to them that he was actually listening carefully. And of course, his physical examination was equally detailed. And he spent a lot of time stressing assessment. So assessment of certain aspects within the subjective and the physical examination and marrying those together, what we would call clinical reasoning now.
Yeah.
And of course, the clinical reasoning itself has been taken a lot further by students of his, and I'm thinking of Mark Jones and others. So Geoff was very important in what he offered us in there. But what people seem to know is that he was um, very insistent that the APA have its own journal. So he pushed hard for us to get our own journal of physiotherapy. And of course, he contributed articles to that throughout his whole life, or not his life, but his profession, I should say. And then, of course, the other big area that he contributed on was to the formation of a college of physiotherapy.
Yeah.
And he and some others like Mari Hammond in Adelaide and Pat Kosh in Victoria, three names that quickly come to mind, they formed a group early on, and they spoke to Brian Gandevia, who was the editor of the journal, and he strongly said, well, you really need to start with small groups in each of the states and territories, where you actually present formal papers to the group and then have group discussion. And these were called Physiotherapy Societies. And as I say, they were separate from the APA. Or the one here in South Australia, to which I got invited as I grew up, they consisted the lecturers at the school and senior clinicians in the hospitals, and they gave learned papers, which many of them then were submitted to the journal for publication. But that was sort of the beginnings of how we started to assess the value, I guess, of physiotherapy. And Geoff had a lot to do with that. So that's why I feel he's given so much to physiotherapy.
Yeah. I really like that idea that there's a melding between the clinicians and the researchers in the discussion and the development of a paper, because in some ways
Yes.
we've lost a bit of that.
Mm-hmm. Yes,
Papers,
I agree with you.
research and papers being generated that probably to the average clinician on the street doesn't have a lot of relevance. So that was, now was that also perhaps the start of then the special interest groups like the MTAA in
Um,
those days?
well, we didn't, I'm just trying to think. Can't even remember when we started. Well, the MTAA started after the first 3 months course,
Right.
because it was Geoff, Brian Edwards, the other two that I can't remember, and myself. We were the ones that first put forward the idea of having a group to which you could only join if you had passed the 3-month course, or later the graduate diplomas and then master's programs.
Yes.
So it was a select group of a few of us that started. Standards of clinical practice were terribly important to us. We would meet, get together and present work, and it went on to developing conferences and the like, as you would remember. And of course, it changed its name from Manipulative Therapist Association. It became MTAA of Australia, and then now, of course, it's musculoskeletal physiotherapy.
Yes.
And I think we started that at that time, and that was prior to the CSP getting their little group going, but it
Yeah.
was pretty much at the same time.
Yeah. So
And
that's the Chartered Society of Physiotherapists.
society. That's right, yes.
Yeah. Now that, so we're talking, I'm guessing late 60s, early 70s at this stage. Come the mid 70s, we had that sort of pivotal moment in physiotherapy in Australia when we became, I guess, primary contact practitioners. I
Yes.
believe that around that time you were the national president of the APA, so you'd actually started to move into the political arena a bit, haven't you?
Yes, I hadn't actually belonged to our South Australian branch committee, but someone on that proposed me for membership of what the committee name was nationally. So that was really my first strong involvement in committee work. Was nationally, and we a number of us strongly felt that we were at the stage in our development, this is the APA I'm talking about, to be able to make our own decisions and work without medical referral. But that's actually a bit further on. If we just take it to when I first joined, the physios were not chairs, and this was at branch level too, as well as nationally. We had doctors chairing our meetings, and I've often wondered why we did it. And I was asking Alison Kinsman, who's in her mid-90s now, I asked her the other day, why did we do that? And she said, well, you really have to go back in history, probably back to the 1940s, when we were first formed, and we very much followed the CSP, Chartered Society in England. And over there, they were very much under the aegis of medicine. And even when I went over there to work to be registered, it was in a section called Professions Supplementary to Medicine. So physio was in there. And so there wasn't any difficulty in us deciding to change to have physiotherapists chair the meetings.
So now just to clarify that, so you're saying that at a branch level, if the MTAA was meeting, you would have a doctor as the head of that meeting, the chair?
No, I'm not saying that. No, only as far as the branch council.
Oh, okay. Right.
I don't think any other subcommittees at all were really working with the doctors as chairs. I think it was just the branch councils.
Right.
And it was, I know they were drawn, some were orthopedic surgeons. I can remember having a neurosurgeon and a rheumatologist. So they were eminent doctors within our area in South Australia, for instance.
Yes. But as you were saying, that then leads to the next component too, which is that at a national level, our APA presidents were also orthopedic surgeons or doctors, weren't they?
They were, yes, because Margaret Peel in Queensland was the first physio one, and then I was the second.
Yes.
So it was sort of from then on, we had our own physiotherapists as chairs.
And I think we're talking 1975, 1976. Would that be about right? That's probably a tough call, actually.
Yes. I actually can't remember. But
okay.
It's either then or just a bit before that.
Yeah, because
anyway,
if we work backwards,
70s.
1976 was when we got primary contact. I think it was a couple of years before that was when the first physiotherapist became the president of the APA as opposed to a doctor.
Mm-hmm. Yep.
And you were the second person. But that then means that you and the first lady would have been quite instrumental in getting this whole process going of primary contact practitioner, because I'm guessing it was it encouraged by the medical profession, or were they resistant to us becoming first contact practitioners?
Well, I think some of them were resistant and felt that physiotherapists needed to have their medical diagnosis. But first of all, thinking within our own profession, most senior physiotherapists and both clinicians, those in hospitals, private practice, and at the university, there was strong support for us rescinding the referral ethic. And what I think is not generally remembered is that New South Wales was the only registration act that required physiotherapists to work under supervision of medical doctors, on referral from them, I mean. So the change was, everyone thought that we all had to work that way legally, but we didn't have to. And the other important thing was that what do I want to say? Our insurance did not require medical referral. So we were covered under our insurance, and so long as we worked within the scope of our physiotherapy expertise, then we would be fine.
That's very interesting. So you're saying that other than New South Wales, everyone had the option of primary contact status, both by
Yes,
insurance and by referral. It was only the New South Wales colleagues that had to have medical supervision or referral.
yes, but and that is so. But I rather think that most physiotherapists thought we had work
Yeah, I certainly did.
legally. Mm. And the ones that initially pushed for the change, interestingly enough, were the paediatric physiotherapists in Queensland. And because they really were not needing any real guidance from the doctors at all. And they made the first push. And then we certainly did have pushback from some of the older members of our profession. They really didn't think that physiotherapists could diagnose, and they likened the sort of diagnosis that we do for our patients to the medical one, which required, say, blood tests or radiological imaging or something like that. And of course, we have never been able to do that. But it was put to I did quite a lot of, as national president, going to major meetings set up in Victoria, New South Wales and Queensland, the three big states, putting the case for change. And I certainly got a bit of kickback at those meetings, but there were enough in the audience that were very strongly supported our change, and it was put to the vote at an AGM in New South Wales, and it was passed. And then we got a message from WCPT, the World Confederation of Physical Therapy, that they might actually expel us from membership. So our two delegates were Pat Trott from Victoria and Doreen Moore from New South Wales, both heads of schools, and Doreen had been a president of the WCPT, so she knew the workings well and knew lots of WCPT
Contacts.
people around the world, and they put the case, and it passed, and we remain. Well, it was the fact that we had rescinded the ethic that was accepted, and we certainly were not expelled from WCPT. But it actually took some years before some countries to follow suit.
Yes. Before we get to that sort of process, can you just tick off on your fingers what you would have said were the key selling points to those that were not encouraged to go as primary contact practitioners? What did you see as the main positives of it?
I suppose the fact that all our programs were within universities, and that part of our curriculum involved pathology and medical diagnostic aspects, that we practiced ourselves using our own type of diagnosis, and talked a little bit about our subjective and physical examination and how we diagnosed from that what the patient was suffering from, not in medical terms, but in terms of signs and symptoms, and how we planned our treatment, and how we also were cognizant of when we needed to refer our patient to a doctor, so that it was very much a two-way thing, when we needed their expertise. And that was very much stressed, that it would not cut us off from the medical profession.
Yes. So we're very much sort of staying within what we were doing, but at the same time, independently moving to our own decision-making process with assistance from the medical profession.
I've just got a thing on my screen in which you're asking me to start my video. Do you wish me to
Correct.
do that?
You've gone black on me.
Right.
Ah, you're
Oh,
back.
there I am.
There you are.
Back.
Okay, so that's okay. At the same time, so we had primary contact status, which is a huge thing for our profession as far as taking responsibility and developing impetuousness to move towards a research-based, I guess, profession at the same time to justify the types of things that we provide. What were were there other key things that you were involved with that you see as instrumental during that period of time that you're national president of the APA, Pat?
Um, well, another important one was really the development of the Physiotherapy Research Foundation. Did you
Yeah.
mean me to go off to something else?
No, no.
Um,
This is a chance
yes.
for you to blow your trumpet.
Oh, no, no
No,
trumpet to blow.
just what you saw at the time. What you would think were key issues that came up, because often a presidency is defined by certain issues that arise. Were there other
Yes.
things, and primary contact as one? Were there other things that happened during your term as president that you thought were particularly important for our profession?
Well, the development of the Physiotherapy Research Foundation, I thought, was really important. At that stage, we had students doing research work as part of their graduate diplomas. We then moved into actually research degrees, so master's degrees, but there was no PhD candidates at that stage. That came a bit later. And we had physiotherapists doing research as part of their, say, graduate programs. We had physiotherapists in hospitals doing work, a tiny bit in private practice as well. But it was exceedingly hard for physiotherapists to get off the ground. We were not eligible for ARC, Australian Research Council, or National Health and Medical Research Council. We weren't in any way able to get funding from those sources because we had no track record.
Yeah.
And one of the main reasons that physios couldn't get going was they had no financial help to get going. So a group of us formed a steering committee, and then we put together, we sought advice. I can't remember the name of the company now that was teaching professions how to raise money. And I can still remember this fellow saying to me, if you can get one person to give you $1 million, it's better than finding 1 million people who will give you $1. And I thought, oh, well, so what, So I wasn't all that impressed with that. And he also came to my practice one day. So I don't know how I got singled out, but I did. And he said, now you are really very supportive of physiotherapy research, aren't you? And I said, certainly. And I said, but he said, well, do you hold a master's degree? And I said, yes, but it's not in physiotherapy, it's in anatomy, because when I did it in the 70s, there were no master's degrees in physiotherapy. And he said, well, I believe that some of you are interested in raising money. And he said, and he actually asked me if I'd give $25,000. Well, I nearly fell off my stool in my rooms. And so I thought, well, I'm not going to even answer that question. However, they then wanted a group, wanted each state to nominate people that they thought were highly respected and who had money. And they wanted us to go through all our membership and grade them between high earners, middle earners, and low earners, what you perceived. And based on that, to select the high earners and for a group of you to go around and actually interview them and ask for money.
Huh.
And that was, that was sort of how apparently you do raise money, but that was a very awful time and highly, it was embarrassing to have to go around and talk to people. Not that you told them that you thought they were a high earner. Anyway, we were trying to raise $1 million. Anyway, we didn't ever get our million, but we did get raise quite a lot of money. And as this steering committee, we formed two major committees. There was a grants review committee, who actually comprised our top researchers in Australia, which most of whom were from university background. So they were a committee that would assess the applications from physiotherapists for grant money. And then the other committee was a management committee that actually dealt with the mechanism of giving out grants and ensuring that the money that we had available was invested well, because we were going to be giving grants out of the money we invested, not going back to the original.
Capital.
So the capital, that's right. So we then put out called for applications for research, and it really is from back at that stage, which was in about 1990, I think we did this. So we then provided what we call seeding grants, and they're still called that, of about 10,000. I think they've gone up to about 15 or more now for new researchers whose research was deemed suitable by the Grants Review Committee. Then we gave out seeding grants, depending on how much money we had. And at times we were able to give out money to, bigger amounts of money for research projects that we thought warranted it, like Gwen's management of sarcogenic headache.
Yes,
I remember
huge.
giving a grant to that one. And it's interesting that now, some 30 years later, we've still got our physiotherapy research program, foundation, and they publish every now and again how many of the people have received grants and how many have gone on to do their PhDs. I don't have those figures, but it was really very pleasing to see how these small grants had helped physiotherapists to grow in their research. And so that was another major thing that I remember from the time when I was president, and I stayed on the PRF. I think I chaired it for about 10 or 15 years or something. So it was quite dear to my heart.
Yes, and it's interesting that it started out of the need to have money that wasn't available because of physios not having a track record in research. And you look at our contribution now to the research body, and it certainly has blossomed, hasn't it?
Hasn't it just? Yes.
Yeah,
yes,
it's fantastic. Now, you're also at the vanguard of the formation or the involvement of the Australian College of Physiotherapists. I think you're one of the first to complete your specialisation with Brian and Geoff at that stage.
Brian and Geoff, yes, that's right.
So I believe you scared the hell out of your examiners, I'm gathering.
Well, they scared the hell out of us, I must say. It was very, very stressful. I mean, the exam process back in those days was awful. We had I think it was 2 papers we had to write, 2 3-hour papers, based on about 20 topics that we had been given prior to that to research. So there were those 2 papers, and then we had 3 patients that we had to examine over 3 days. So an initial examination and 2 follow-ups. So thank goodness it's been reduced now, but but it was an interesting time, and I mean, you couldn't have better people than Lance and Gwen and Roberta, and
As your examiners.
Examiners, and probably the person that was hardest to relate to was Roberta Shepherd. She was, of course, is professor of neurology at University of Sydney. I don't know, possibly she's retired now, but she was well known in that field internationally, and she would ask questions that were hard to answer because you didn't know what she was thinking about, because it was easy to relate to Gwen and Lance. They were questions you could see why were they asking that, and what did they want to know. And,
yes. Well, I guess you had a similar background to Lance and Gwen, didn't you? But whereas Roberta,
yes,
her background was was it peds and neurology or just neurology?
Just neurology, I think. Yes.
Yeah, so you're not
Yes.
quite sure what they're asking for.
And
Yeah.
and I can remember one of my patients very well had, it was a hand injury, and they were actually going to be amputating a lot of it and transposing the thumb across to the little finger to give them some amount of grip. So Roberta asked me, why didn't I look at extension and abduction of the thumb? And I replied that I didn't, because that was not going to be part of the function of the hand once it had been transposed across. It was flexion and opposition, and it wasn't, the other wasn't of importance, because it wouldn't even have those joints still there after they'd done the surgery. So I can remember that and looking at her and thinking, I don't think she agrees with me. But, dear.
You obviously got
Anyway.
through. So, in a broad
Yes.
brush sense, why was the college formed? Like, I'm not sure about the initial history of it. If you were the first group to go through, somebody must have preceded you to set the college up.
Yes, they certainly did. And I guess I really would strongly advise anyone listening to this that they actually look at our motion. This year, there have been 3 articles. I've got a dog coming up. 3 articles so far written on the college. Gwen and I wrote the first couple. Barbie Singer has written the one that's just come out last week. And then I think it's the presidents are writing, Darren Beale and, Darren Beale anyway, are writing what they think the future's going to be. And that's obviously much more detailed than I can talk about today.
So that's APA in motion, and you can get them online if you want to.
Indeed, yes.
Yeah.
But just very briefly, Geoff was one of the strongest proponents of starting a college. He really strongly felt that we needed a body that was actually separate from the APA, which happened, but it was actually under the aegis of the APA, but autonomous, to be able to recognise scholarly work and also expertise clinically. We needed the 2 branches of that. And there was a group of physios in each state that supported that and formed, they were called founders rather than, they weren't actually members of the college, but founders of the college. And they worked hard to put together the beginnings of the college. And
they were all physios?
Yes, they were all physios. I've got somebody white was one from Western Australia. He was the head of school there. Do you remember him at all?
No.
And there was Lance might have been part of that as well, and certainly Pat Kosh and Mari Hammond. They played a very strong role in helping to put together the initial thoughts that would go into a college. And there was some medical people also were part of that.
Yeah.
And that's very much where you might say those initial physiotherapy societies played an important role, where they were doing research work, presenting it to a group and disseminating that knowledge through publication mostly. But so it's going back quite some time now where the college started. And we were really, I wasn't part of that so much then, because I didn't have to do a lot about it until I actually became a fellow of the college. And then I had quite a role to play, particularly as I was an academic at the school. I could help a lot with the development of the curriculum. And initially, of course, it was musculoskeletal, and later spread to the other fields of physiotherapy. So, and I suppose probably for about nearly 30 years, I was an examiner for the candidates, firstly in musculoskeletal, and then as the other fields came on board, I examined with another person who was senior in that area and who had the content and clinical knowledge. So my role was very much looking at getting good comparison across in standards across the various fields. I don't know, what else did I do? Oh, I was a vice president at one stage, and secretary and chief censor. So I've had
Yeah.
a lot to do with the college.
You've
But
seen the whole gamut of it.
yes, but nothing like the contribution of Gwen Joel, who is even still involved. So good on
Yeah.
her.
Yeah, no, she's pretty awesome. And like going
Yes.
like in a broad brush sort of sense in regards to the specialisation and the college itself, what do you sort of see, or do you have a feeling for its role going forward?
Yes, I do. I think it needs to play an important role. I understand now that the professional development of physiotherapists is coming under the aegis of the college, where the college initially, as we had envisaged it back then, was really for those who wanted to specialise. But it's now you get titled members, and the professional development of physiotherapists is very much under the aegis of the college, and obviously the APA to give manpower and finance to do that. But it's if we want to stay at the front of healthcare in Australia, we really have to have very good people, very good clinicians that have expertise, but they need also to be able to be good at disseminating information about physiotherapy. Well, I suppose the medical profession, so that we get referrals and so on, but very much to the general public, so that physiotherapy is foremost in their mind when it comes to the delivery of healthcare. And really, all of us, going right back to our undergraduate training, we are well skilled in our ability to verbally communicate with people. And therefore, I feel that I wouldn't like to see in the future that people think, oh, just leave it to the leaders. I think everyone can contribute to where physiotherapy goes.
Yeah, well, I just come back from spending a week and a half diving in the Rolly Shoals, which is 300 kilometres
Yes, where's
offshore
that?
from Broome, and just sitting on board a boat with 20 other people. It was interesting how many conversations would come around to aches and pains and ailments and lifestyle choices. And even I was talking to one guy who just about Peyronie's disease, and explaining how physios now have a role in dealing with, in in his language, bent dicks. And I sort of said, well, yes, it's a very, it's a huge thing for guys, mental health wise, and to know there's something they can do about it and do something about it. Now we've got the research to show that can be helped. But, and as he said, I would never think of going and seeing a physiotherapist about that. So I said, well, that's the point of this conversation. Everyone that's listening to you and me and around us now have an
Yeah.
idea that, 10 to 12% of the males have this problem, and it gets higher if you have prostate cancer or other problems like that. They don't
Yes.
have to live with it. There is something that can be done. And that's, as you say, these conversations need to be had simply as an informative process, that there's things that can be done rather than avoided or ignored.
Yes, I couldn't agree with you more. So it
Yeah.
was sounds as if you had quite an interesting time on the boat.
We certainly had some interesting conversations, that's for sure.
I have been on 2 deep sea fishing trips out of Broome,
Right.
and caught some very nice big fish. I was quite proud of myself, really.
Yes. Well, there's some big fish out there, that's for sure.
Yes, no, it was fun. Mind you,
Hmm.
the sharks tried to bite it off your line before you got it in, but still, it was fun.
Yeah, they call it GST out there. You catch the fish and the shark takes his bite of it. Yeah.
Oh, okay, yes.
So if we come back to your time, so that's looking at you and your involvement with the APA, your involvement with the Australian College of Physiotherapy. If we just bring it back to a bit more local to Adelaide, you've had a long involvement with, I guess, both the South Australian Institute of Technology, and then when it moved into becoming the University of South Australia. That sort of first started when you were teaching on the 3-month and then the 12 months MNIPS course, I guess, didn't it?
Yes, I mean, I've taught mostly in the postgraduate area. I did some undergraduate teaching,
Yeah.
and I was also involved in research. I've always had some involvement there in my own for a graduate diploma, and then I did my master's degree back at the University of Adelaide in anatomy, in the carpo-metacarpal joint of the thumb, because I feel I should say that we and apes are the only ones that have an opposable thumb.
Yes.
So I thought, well, that's a very important joint.
Absolutely.
So, I mean, that was my formal, but I started my PhD, then I became head of school, and I found I really wasn't spending much time on my research work. So I actually pulled out of that, something that I regretted a lot at the time. And I'm ashamed to say that my mother said to me, "But didn't you agree to be head of school?" And I said yes. And she said, "Why don't you just get on with it?" I thought,
Stop your whinging.
How to be at my age and have your mum tell you that. Anyway, but I've had a lot to do with research supervision. And even after I retired in 2000, I was an adjunct associate professor after that. And for 7 years, I supervised PhD students, which was a great way for me to ease out of my professional work and retire. So,
well, before we let you ease out of your professional work, how long were you head of school at the University of South Australia?
7 years.
Okay. And key things, did you finish your PhD during that, or did you wait till you finished?
No, I have never actually gone back and finished my PhD,
okay.
which sometimes I think is a pity, and other times I think, oh, there's so much more to life than physiotherapy.
I couldn't agree more than that.
Yeah. So
it was pretty hard work being head of school. What were the big things that happened when you were there?
Well, there were a couple of things that are always difficult for heads of school. The first one is funding.
Yes.
You know, the universities, I mean, you would be familiar in Western Australia, the same things happen there, where the universities are not very supportive of our postgraduate programs, our master's programs. I've gone out of sight. I'm going to put myself back on. In our master's program, for instance, the ratio of staff to student is high, so it's expensive, and you have small numbers, so it's very hard to put a case to your dean and pro-vice chancellor above you for funding. So it's quite difficult as for head of school, and we really needed to keep our overseas student numbers up. And I played quite a role in that because I had done quite a lot of teaching overseas and then continued to do that in the UK and Europe and the USA. But I particularly added teaching in Thailand and India. I had a number of Thai students come for our master's program, but also as PhD students. And my staffs came to me and said, if you could get one more Thai student, you know, what they might do. And it was because the Thai language is so far removed from English. It's very hard for them to express themselves in English. And they are a lot of hard work when you're supervising their thesis work.
Yes.
So I looked around and thought, well, I'll start in India, because in India, tertiary education is in English.
Yes.
And I thought, well, they will be easier, and they don't have any postgraduate programs, so I should be able to recruit from there. So I taught 2 or 3, probably about 5 courses, I think, only in 2 places, in Chennai on the east coast and Mumbai over on the west. And from there, we did get a number of students, but it, unbeknownst to me, is once they had finished their course, if they came from a home that didn't speak English, then their English skills just dropped away enormously.
Right.
And so And in the end, we actually brought them over and put them through a 6-month virtually undergraduate program to bring them up to standard. So that was a difficult time. So I think that if I'm sort of thinking of difficulties, funding would be one, and the other is finding clinical placements in our hospital. Of course, it must be a real headache now, because instead of having just one physiotherapy program, there are 3 at Flinders Uni, and Adelaide is just in its first year this year.
Yeah.
So they've gone back to having a physio program, which rather relates back to your first question at the beginning. Did we ever think of going back? But anyway, I've often wondered why they didn't start a physiotherapy program, because it's very popular.
Yes.
And has one of the highest cut-off points to get into university.
Yeah. And in that sense, it often brings in the brightest students, doesn't it?
It does, yes. And no, they're challenging to teach, but very rewarding.
Yeah. In 2009, when I was doing or starting my research into sleep, one of the papers, or the group of papers I came across, you had, I guess, co-authored with Susan Gordon and Karen Grimmer, looking at pillows. It was quite an ongoing theme there for a few papers. What was it that brought you into that sort of area? Was that your general supervisory role of PhD students?
No, it started by the manager of the feather factory here in Adelaide, came to me in my private practice and asked me, could I design the perfect pillow? He was expecting feather. And I, of course, immediately thought of Geoff, who used to teach that feather was the best filling you could have, because it's molded to the shape of the head and
That's
neck.
interesting.
And the worst were rubber pillows, because they tended to bounce and would irritate a irritable neck joint. So I said, well, I didn't really like feather pillows because all the feathers ooze out, and you're forever bunching it up. And he said, oh, that's not a problem. He said, I could, then he set to work and drew me a little diagram. He said, look, I could divide the pillow longitudinally into 3 sections, and you could have the head, neck, and thorax on that, so that you would have more filling of feathers in the middle one to support the neck than you had for the head and the thorax. So that was to be on one side. Then you could turn the pillow over, and for those that didn't like a segmented pillow, that half would just be the same consistency of filling.
Oh.
So he did that, and I trialed it for a while in my practice and with fellow physios, and it was called the Encore Pillow. I don't know why he chose the name. And we marketed across the whole of Australia only through physiotherapists. But of course, it didn't have any research to back it at all. And so then Karen Grimmer and I thought, well, let's set up a program, and we will measure physiotherapists' head and neck upper thoracic posture with subjects lying on different pillows. And then Sue Gordon came on, and she wasn't, I don't know that she was involved initially. It might have been just Karen and myself. Anyway, and interestingly enough, we looked at about 5 different fillings of pillows, but we actually didn't use the Encore pillow.
No, you didn't.
No, which
why
is
was that?
interesting. I don't know. We just thought we had too many pillows as it was, and it was quite a business having subjects sleeping on each of these, and having to trial them at home and report back, etc. So that's how that one really got started. And then I got some funding from one of the mattress companies to do some look at mattresses, but they only wanted me to look at their mattresses.
Fancy that.
So I looked. So again, I looked at different types of spring and soft furnishings on the top, and Sue Gordon was very much on then, and we looked at spinal posture and again inside lying. So that was how those I suppose publications came your way.
Yeah. And you have been involved in, I mean, it was interesting also that you found the feather pillow was the only one not to be recommended by the participants of the study,
Yes.
wasn't it?
Oh, yes, I forgot to say that. Yes.
I thought I'd just put that one in there, Pat.
Yes, that was the worst.
Yeah. But it's a shame. Well, it's a shame they didn't use the Encore, because you must have got some feedback from your patients saying this won't work for them, but it wasn't included. Anyway,
Well,
we'll
and
leave
I
that.
still have one myself.
I do.
I still use one. So there we are.
There's a personal recommendation. So of all the pillows, oh, sorry, not all of those, of all the research papers that you have been involved in, either primarily or as a supervisory role, would there be one or two that you think stand out of importance for clinicians?
Well, I was certainly involved in Gwen's multi-centre trial for the management of cervicogenic headache.
Yes.
And I thought that was one of the most outstanding ones for me to be involved in. And the other, I suppose I would select looking at backpacks and school children.
Ah, okay, yes.
The effect of that, which we then went on and
That-
designed a backpack,
Yep.
which went on production.
That was
They would
Karen
be the
Grimm as
two
well, wasn't it?
things. With Karen, yes, that's right.
Yep. And then it
You
went
know
on
where
to,
she is now?
pardon?
She's over in South Africa now.
Oh, no, I didn't
And
know that.
yes,
Teaching or?
she's had a number of PhD students from there, so she's still doing a bit of research supervision. To be honest, I'm not sure what else she's doing over there. I must get in contact with her again. But she's, I think, thoroughly enjoying life, a different life over there.
Yes, that's brilliant. Just in general in your professional life, are there three key things that you feel particularly stand out for you? I mean, we've gone through a bunch and like they're all highlights and they're amazing. Is there anything else that you feel we haven't covered in your professional life?
No, I think we've touched on the main things. I mean, specialisation was very important for me.
Yes.
As I mean, personally, for my own practice and my clinical teaching. So that has certainly stood out for me. I suppose, I don't know whether I should even mention it, but I really was very honoured to be given a medal of the Order of Australia.
Yes, you should mention that. That's pretty special.
2012. That was for my service to physiotherapy nationally and internationally. So that was a highlight for me to be given that.
And thank you.
And I suppose I've had a couple of other recognitions. I'm a life member of the Manipulative Therapists Association.
Yes.
And and an honoured member of the APA. Yeah. So that's been great. But I'm just very grateful for the opportunities that I've had. I haven't married and had children, so I've been able to devote quite a bit of time to my profession, and I've just loved it. So
we're exceptionally we are so lucky to have had yourself and other people like you that have contributed so much to the onward development of our profession, because it needs some real movers and shakers.
Well, I guess we did a bit of that.
Yeah, absolutely, and had fun doing it too, yes. I'm sure.
Yes, indeed.
Hey, look, if you could step back, Pat, to your younger self, are there three bits of advice that you would like to pass on to yourself?
Well, when I did it back in the 60s, it's so different. So I suppose I should think of young people today. What do I think is important? And I think first of all, I think you've got to really love what you're doing. I'd hate to get up in the morning and feel, oh, what a drag, I've got to go off and treat patients or teach or whatever you're doing. That would be awful. So I think it's really important to love and enjoy what you're doing. And you can't help but when we're working with people, for that to be pretty obvious, whether you like it or not. It comes through in your demeanor and what you're saying and what you do and how you do it. So I guess that would be number one. Probably fairly early on to think about whether you'd go on and do specialisation, or perhaps even before that, do some postgraduate study in a field of interest, and then perhaps specialisation, so that you're ever putting yourself up for more challenges in your work and in your profession. I think that's important, and I really would have to add going overseas as another highlight. You learn so much by seeing how physiotherapy works overseas in different countries, and so there are lots of, although they would be the main things I would suggest that they do, because
Brilliant.
it's a terrific career.
Yes. Yeah. And speaking about a career, looking forward, where would you like to see this profession of physiotherapy going?
Well, I'm partly biased by the fact that I've just a couple of days heard Phil Calvert. He was national president, just the immediate past one. I don't know whether you've met him or not, but he actually works in paediatrics and has his own private practice, which is sort of interesting. I shouldn't say interesting for a bloke, but however, that's his field. You better delete that. He was talking about the advocacy that they're doing nationally at the APA, particularly with health bodies, funding bodies, etc. And I was so impressed with what they're doing, the scope of what they're doing, and how important that is for the future of our profession. So I'm sure they will be going on doing that, but I see that as really important. But then back at our level, individual levels, we can do so much of advocacy of our own, thinking about how we need to put physiotherapy up in front of the general public and for them to see us, just like you were talking on your fishing trip. And these opportunities do arise, so they are important that when they do, that physiotherapists grab them. And we need to, of course, be thinking about the quality of our work. And I'm a great believer not only in our interaction with patients, but also our manual handling skills. I come from back that far, but I see that as a really important part, and that you convey so much through your handling as well. So I'm be sad to see that being dropped, but I know the profession is changing and has to change to meet with changes in the delivery of healthcare in Australia. And so I'm talking about those things, but I'm actually very chuffed with what's being done by our young ones. I think they're terrific. I go to physiotherapy class twice a week, and sometimes there's a young one there, and I think, gee, they're terrific. They're really stimulating and they care about it. And if we can have people like that, I think we're going to continue to go places.
Yes, it's lovely to see the passion of those that you interact with. I agree. It's really nice to see the enthusiasm and the passion they have to help people as a physiotherapist. It's beautiful. It's really nice.
Yes.
Yeah.
Yes, it is.
Well, Pat,
so we're both lucky to be of that profession, aren't we, Doug?
yeah, and I think there's such a diversity within the profession, which is part of why I wanted to do Physio+10 podcast, was just to demonstrate to the young ones, as you call them, that there are many avenues they can explore. And I agree that for us to develop as an individual and as a profession, we need to continue to challenge and explore new options and new avenues for our profession and as individuals. And you do that with the understanding that not all things will work out, but it's that exploration that is part of the journey as well.
Yes, indeed. Well, it's been a pleasure to talk with you, Doug.
Pat, it's been an absolute joy talking to you, and I thank you so much for your time and sharing all your insights. And also thank you so much for the physiotherapy things that you've developed in our profession, because I'm sure physio would not be the same in Australia without you and your contribution. So thank you so very much, Pat.
Many thanks, Doug.